Hello, I am Dr. Shailaja. Pain during sexual intercourse is called dyspareunia. So, why does it happen? It can be structural, it can be psychological, or it can be hormonal. So, vaginismus. So, vaginismus is involuntary tightening of the vaginal muscles. It happens because of the stress, anxiety, or any childhood sexual trauma, sexual abuse, lack of emotional intimacy, relationship problems. All these things can lead to vaginismus. Or there can be dryness of the vagina. Dryness of the vagina is because of ineffective arousal, or it can be because of the hormonal scarcity, it can be following childbirth, it can be following breastfeeding, or menopausal. There is lack of estrogen, so vagina becomes dry. So these things have to be addressed with the help of lubricants, water-based, silicone-based, or there is lack of estrogen, we can treat with estrogen creams also. So then coming to deep dyspareunia, there is some problem in the pelvis. It can be endometriosis, ovarian cyst, fibroids, adenomyosis. So pelvic inflammatory disease, all these things can cause pain during the deep penetration. So these things have to be addressed with the help of ultrasound, certain investigations, finding out what is the cause and treating the underlying cause. So then coming to the outside part. So the vestibulitis, if at all there is infection or dryness of the outside vestibule. The outside portion, the vestibule, can become narrow because of so many conditions like post-menopause, or there can be lichen sclerosis where the entry itself is difficult. There can be vaginal infections, bacterial vaginosis, fungal infections, protozoal infections, where it causes inflammation and causes pain during intercourse. Following surgeries like hysterectomy, cesarean section, vaginal deliveries, what happens there is episiotomy. If we don't allow proper time for healing, so then there can be pain during sexual intercourse. That is why we say at least for 2 to 3 months avoid sexual activity following the pelvic surgeries, because vault can be tender, vault can be little raw. So that is the reason giving adequate time following surgeries will help preventing dyspareunia. So always there are so many reasons for dyspareunia which has to be identified thoroughly by a healthcare provider, and your care, your treatment has to be personalized. Don't generalize the treatment. Okay, my friend was using some cream, I'll also use the same cream. It doesn't work that way. So many times we have to use vaginal dilators, creams, medications. We may have to treat the infections. Or we have to treat the pelvic pathology itself. So that is the reason, address all the issues thoroughly. So if at all you have any emotional issues, relationship issues, don't hesitate to go for counseling. The couple counseling will help a lot to overcome this sensitive issue, dyspareunia.